We are so glad that you are joining us for this really important webinar. It's around how to support your child with a mental health emergency, and we're going to offer guidance on alternatives to the emergency room. We've got two amazing panelists joining us, Annmarie Caracansi. She's medical director and inpatient psychiatry service, and she's with the Department of Psychiatry and Behavioral Services here at Boston Children's. And we have Zheala Qayyum, attending psychiatrist, Department of Psychiatry and Behavioral Services, and medical director of the Emergency Psychiatry Services and training director of the Child and Adolescent Psychiatry Fellowship Program. Thank you both for joining us. I just want to mention these CDC statistics that are very scary and troubling, but well, let's just start. The number of teenagers and young adults with clinical depression have more than doubled between 2001 and 2021. The suicide rate for teenagers have nearly doubled between 2007 and 2019. And they've tripled, that's right, tripled for 10 to 14-year-olds in this particular group. And according to the CDC, 25% of teenage girls made a suicide plan in 2021. Certainly so scary and heartbreaking. But if it's your son or daughter, I think that's probably the first priority, son, daughter, who's going through this. And I know a lot of parents are at just so confused and scared. So I'm so glad that we've got two experts on this webinar to help us with this and to answer lots of questions. Should we just talk about what is the state of clinical depression with these teenagers after the pandemic?
I think, Brian, you're absolutely on target. Like, there's been a very marked change, but it was a change in the making. Like, we were seeing these upward trends even before the pandemic, and they've just continued to get worse. And in October of 2021, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association all came together to declare a national state of emergency in child and adolescent mental health. And the Surgeon General said that, kids' mental health crisis, mental health is a crisis of our time.
Right. Dr. Caracansi?
The CDC report released in 2023 that you may be referencing, it was called the Youth Risk Behavior Survey, and it collected data from teens in the fall of 2021, and it gave us our first look at trends since the pandemic. But as Dr. Qayyum said, even before the pandemic, the trend was leaning into mental health crisis, with worsening mental health challenges, more experiences of violence, suicidal thoughts and behaviors. So that data was out there, and that was sort of, again, gave us some numbers to what we've already been seeing.
Yeah. So what are, I guess, for a child and their mental health, talk about the patients that you see in these acute settings. What are they dealing with? What are they exposed to? And maybe things that maybe parents don't know that these children are being exposed to. Maybe let's elevate that.
Well, I think one of the things that was also highlighted very recently by the U.S. Surgeon General was the effects of social media.
Yeah.
That they said, we're in the middle of a national youth mental health crisis, and they're concerned that social media is an important driver of that crisis. But our children and adolescents are being impacted by many other stressors in addition to like social determinants of health, social conflict, racism, violence, and trauma that all our youth are being exposed to that parents may not be able to control. But I think it's also very important that parents know what are the protective factors. We have a lot of risk factors around us, but things like positive relationships with peers and families, a sense of connectedness, a greater access to care and mental health treatment are important contributors to preserving mental health. And I think we all acknowledge that we need to pay attention to this mental health crisis. But really, when we're thinking about why kids are coming to the emergency room, I think one of the most important things to highlight is that mental health is a key component of children's and youth's overall health. It's not something separate. So it may be easier for parents to recognize physical illness in their child, for example, and pick up the signs of that. But we see kids struggling with, worsening anxiety, mood symptoms like depression and stress that can manifest in, behavioral changes or some outwardly directed behavioral changes, getting upset very quickly, being very impulsive or engaging in risky behaviors that they typically wouldn't be. And in these instances, whenever parents notice that there is a change in their child's functioning, or that over time they are not functioning like they used to, they're not interested in things that they were interested in, or they're losing their peer relationships. So they're losing sight of those protective factors and that sense of connectedness to reaching out to the trusted adults in their lives or their close peers that are positive. I think, or source of support, the first thing we have to do is really let the parents know that the first line of help is really in the community, the people around them, their primary care physician that they are connected to, that sees them periodically and has a longitudinal relationship with them over time, and has this child and family, they've seen their development over time, or school-based services like their guidance counselor, or if they have school-based therapy, or their class teachers or coaches that know this child, and this child might reach out to, or they may notice a change in their functioning. Now, I think what's wonderful is that the state of Massachusetts has a helpline, the behavioral health helpline that can connect parents who don't know what to do, or is this something they should be worried about? They can get them connected to urgent care facilities or crisis services. So a lot of times these things can be assessed and managed in the community. And I think this helpline is actually a wonderful initiative by the state of Massachusetts, because parents can get all kinds of information. They can get help or guidance. They can get some input from a mental health clinician, so they can get some idea about really how seriously to take the behavior or the change that they're noticing in their child. But for instance, there's things like suicidal thoughts or actions or self-injury where parents should call, the suicide hotline 988 number, or if there's a medical emergency, 911, and then get guidance about if they need to bring their child to the emergency. And similarly, any threatening behaviors, homicidal threats that pose immediate risk should come to the emergency room. Again, the goal is really safety of the child. And what I think the clinicians in the community can help determine is this something that can be managed in the community with supports, and that they can sort of rally help and maintain the child in the most natural environment, which is their home, and provide services there, versus is this a child that needs to be brought to the emergency room? So again, if there is a change in the child's functioning because they're hearing voices, they're seeing things, they're hallucinating or experiencing psychotic symptoms, particularly if it's accompanied by not eating or drinking, I think that becomes a serious concern. If they're staying up all night and they've got lots of energy, or talking too fast, not making sense, or what we call manic symptoms, or there's change in their mental state because of substance use, that is still very acute, those are things that might warrant a child being brought to the emergency room for an assessment. And similarly, any acute medical problems like medication reaction, if they're taking any psychiatric medications that might be life-threatening. Again, something life-threatening and immediate risk, if there's a sudden change, or there is a risk to the life of the child or other people, that's, I think, where the parent should, pick up the phone, call the helpline or the 988 number, and get guidance from there to see if their kids.
Thank you, Dr. Qayyum. Dr. Caracansi, do you want to add anything to that in terms of breaking down when, I think some parents might feel like, I don't know if we're going to be able to get through this day, let alone this week. We're with that acute threat. maybe break it down more about what parents should be looking for.
Well, I think that, as Dr. Qayyum was saying, that we think about mental health as part of your overall health, and mental health exists on a continuum, right? Everyone feels sad or angry sometimes, right? And so what we're trying to help parents get some guidance around is when those emotions, actions, thoughts, responses, behaviors reflect more than stress that become actually truly distressing, or at its worst can become unsafe. And we want to encourage parents to reach out for help early on before it becomes an emergency,
Right.
before you're at the point where you're going into the emergency room. And we understand and recognize and praise parents that they're the experts on their kids, right? They know their kids better than anyone. So following their instincts, their impressions, that's important. So when they have a gut feeling, that something's not right, then they should certainly be reaching out for help. And often the pediatrician is an excellent first resource for questions and for help, particularly if you've had a pediatrician that you've had a relationship with for your child's lifetime. I mean, they're a great resource, and they're somebody who can certainly help. Other places for input and support are teachers, guidance counselors, religious leaders, coaches, other figures in your community affiliations. Sometimes they might notice something too and bring it to your attention. But I think that what's important about all of that is that there's a sense that you're not alone, right? We are part of a community, and that there are people out there who can listen and who can provide help and some resources. It is hard to navigate the healthcare system. It is hard to navigate the mental health care system. It is hard, but there are ways to reach out to get help. And like I said, the pediatrician's a great first resource. The resources and phone numbers that Dr. Qayyum mentioned as well are resources in the community. So there are ways to try to get help early on, before you're at the point of getting to the emergency room. So I think we can certainly talk more about what the experience in the emergency room is like, but we want to be sure that that things that can be managed in the community are managed in the community. That's less stressful for children and families, certainly.
Thank you, Dr. Caracansi. I liked how both of you talked about community, and I think because of that Surgeon General report on social media, kids, young people used to have these communities of friendships offline where they would work out lots of feelings, and with social media and being online lots of the day, I would think that would be, if a parent, to your point about what is it a parent who knows their kid the best is observing, maybe could we kind of dig into what is that sense of isolation or that sense of being online rather than in that community where those caregivers or authority figures or teachers or religious leaders might be able to check in with them. Is there something that a parent should look out for in terms of that isolation with social media before it gets acute?
I think the landscape is changing, and social media and technology is progressing at a rate that is far more advanced than we have the data. But I think that's what the Surgeon General report highlights, is that there are harmful behaviors that we don't, effects of social media we don't fully understand. But that doesn't mean to say that it cannot be a source of connectedness for a lot of kids.
Right.
There's just a change in how our youth choose to connect. And often we see that there's a lot of tension around electronics and social media use or internet use, because a lot of the friendships, like you said, are not in person anymore, they're online. However, even I think one of the CDC data that showed over the pandemic that even virtual connectedness was protected. So I don't think it's a overgeneralization. There are definitely positive aspects to it, but with everything, it has to be within boundaries, limits, and in moderation. So it cannot be at the expense of other activities or other things. And I think that's where the parents have to weigh in and say, yes, we understand this is part of our lives now. Yes, you're going to have friendships online. And yet these other things are also important, where you're going out to play or you're participating in sports. And I think as long as there is a balance, which is hard to strike, easier said than done, but knowing that you work with your child and empower them to set limits for themselves as well, and support them in providing other avenues of interest, engagement, and connectedness, that I think overall, it'll be a sort of a combined effort.
Thank you, Dr. Qayyum. Dr. Caracansi, any others?
Oh, I think, yeah, Zheala said it well. I mean, I think that those are, some of the principles of trying to find that balance. I think it is, often what we're balancing with mental health and physical health is kind of comes down to some of the foundation, some of the basics, right? You're talking about things like nutrition, exercise, fresh air, all the things
Right.
that we want to, have part of our lives on a daily basis. And it is those things that contribute to and balance out, overall physical and mental health. And so there is a role for technology. I mean, but it needs to be balanced out with everything else. And it's hard to put that structure in place, particularly with teens as they get older, but it is part of the challenge. And sometimes you can get help if a child is engaged with a teacher or a guidance counselor, or there is a therapist in the community. Those are people that can help provide some of the guidance or structure or advice around coming up with some of those guidelines and structures around technology and fitting that in with the rest of your life. So again, I'm telling families that, parents, you're not alone. There are other resources out there, people you can go to for advice, and having your having those people around who can weigh in on that can be super helpful.
That's great. Well, let's we talked about the emergency room. I guess this would be a two-parter. And Dr. Qayyum, I liked you had such a great list of activities that would be troubling, including not eating, drinking, and harming themselves. I'm sure that would be cutting and hearing voices and threatening manners. So I think when we know about the emergency room, we know I go there for a broken bone, or I know the symptoms for appendicitis. For parents that are joining this webinar late, maybe let's just break it down to, what really, let's talk about that emergency room. And when does your son or daughter, when do you really need to think about that call?
So I think the time to take your child to the emergency room is when it's really an emergency.
Yeah.
That it is acute, or if like the efforts that were made in the community to keep the child have failed. So if the pediatrician says, this is really worrisome, you need to take your child to the emergency room,
Okay.
or, you have providers in the community who have managed this child and they recommend going to the emergency room, then I think that's fair. Or the helpline directs you to go to the emergency room. However, I think a lot of times we do see that, just like Dr. Caracansi highlighted, there are very difficult times. There's sometimes not a lot of resources where people live. And oftentimes they don't know what else to do. So I think now, rather than going to the emergency room, the helpline is actually a really wonderful resource. Because if it's really not that acute, then the emergency room is really not the place. What we see in the emergency room is when you bring your child, let's say, to our emergency room, they'll be evaluated by the primary emergency pediatric team. And they will make an assessment of whether a mental health evaluation is warranted and then consult us if it's needed. And so our mental health clinicians then will do an assessment. They will gather collateral information, talk to the parents, talk to the school if the school is sending the child in. They will talk to the outpatient or community providers to see, do they have recommendations about, does this really need something more intensive than was being provided in the community. And usually our clinicians work with attending psychiatrists to make that determination of, what is the level of safety. They will make a sort of a working diagnosis, and then based on their findings, recommend a disposition. Like, is this a child that can, it's not nothing life-threatening. This is fine. They can go back into the community and continue with the supports that they already have in place. Or if they don't, can they go back into the community with some additional support? But really, the time where a child should be coming into the emergency room is when they cannot be supported in the community and they probably need a higher level of care that I think Dr. Caracansi can talk more about. But that is where really they might need an admission because the supports of the community, or this is too acute to be managed there. And while they're in the emergency room, right now we have a mental health crisis. There might be a wait time to get an inpatient bed or a higher level of care available, which could be days and at times even. So I think it's important for parents to get prepared that they might, if they really need an admission, they might be waiting for some time. Although we on our end reassess that need every day and make sure that, there's no alternative available in the community. And then, there are things that can happen within the emergency room, and there are things that can't happen in the emergency room. Like, we can't place a child who needs more of a sort of a residential level of care from the emergency room. That doesn't usually happen. And then I think one of the recommendations we always make to parents is that, if this is a real emergency, you should go to your nearest emergency. So that care can happen soon and then take it from there. And also know that, there is a bit of a dearth of resources. Massachusetts is doing a wonderful job in trying to create more access to mental health care, particularly for the youth. So access that, and if that is not working, that is when with their recommendation we should think about. And what happens at a higher level of care, I think, Annmarie.
Yeah, I would love to hear about that, Dr. Caracansi, because I think for a parent, you forget that a mental health journey takes a long time in terms of treatment and diagnosis and observation, and it's probably not the right place in an emergency room. Maybe talk about that.
So the emergency room is the first step. That's the place where an assessment and collection of information to provide usually a preliminary diagnosis, a set of recommendations, and that's where they'll determine what the next appropriate step is, what the next level of care is indicated. Sometimes it's in the child's best interest to have a lengthier course of evaluation. That lengthier course of evaluation sometimes takes place on an outpatient basis, and the emergency department can provide help or resources to, or recommendations to continue that on an outpatient basis. But sometimes it does lead to a recommendation for an inpatient hospitalization for a lengthier course of evaluation and treatment. So kids who are assessed as needing inpatient admission, it often comes down to safety first. Right. So if a child is a danger to themselves or a danger to others, or so gravely disabled that they're unable to function anymore in the community, they'll need an inpatient admission for ongoing evaluation of their symptoms and treatment. And that evaluation of symptoms can sometimes lead to more testing or a consultation. Sometimes there's lab work, indicated imaging, collaboration with other specialists like neurology or endocrinology. And that's often best done in a hospital setting when there's some high risk involved and some urgency involved. So what the emergency department does in the course of their assessment is inpatient level of care is sort of at the top of the ladder, right? There's levels or steps around the treatment, and that's kind of those beds are meant for the patients who really need that most intensive. And it's also the most restrictive setting. We take very seriously that the inpatient unit is a locked unit. It's a 24/7 locked unit. And that is taken very seriously, that is that at that point, that is what that person needs for their safety. Other levels of care can be determined from that emergency department assessment, like we mentioned outpatient or referrals to outpatient. There's intensive outpatient treatment or partial hospital care, which is not 24/7. It's not overnight. There is a community-based acute treatment, which is a 24/7 hospitalization. However, it is not in a locked type unit. So so there are different levels, and the experts and the clinicians in the emergency department help work with families to try to determine what the best next steps are. But the inpatient side of things is for patients who can't safely be assessed and treated, but for a locked setting.
And I guess then the follow-up, what cannot happen in the ER, or what is the ER just not appropriate for in terms of care?
So the ER would not be able to do things like necessarily, get appointments, access providers who, like in the community. If you're coming in just for, trying to get an appointment or try to find a referral, you wouldn't be able to get a non-urgent assessment like a psychological evaluation or neuropsych testing. Sometimes people are looking for that for and desperately need that for their kids to get assessed and services and that kind of thing through. Sometimes the school needs that or other purposes, but those are community-based services. That's not something that's going to really be accomplished in the context of an emergency room.
That makes sense. I'm just thinking about the parent, the mom or dad or caregiver. They're under so much stress as well. What do you guys, both of you, what would you want to tell them going through this crisis and those decisions which are so important, and probably those parents have never gone through this before? When you pull them aside, what do you tell those parents, and what would you like to share on this webinar for those parents that might be undergoing this incredible crisis for their own family?
I think, like Dr. Caracansi said, you're not alone.
Yeah.
This is a crisis. It is a national crisis, but I think it's also, when we're talking to other mental health clinicians that work with kids across the globe, it is actually a similar situation. Something is changing. You're not alone. We're all in this together. And everyone is doing their best. And I think we're fortunate that we are actually here in Massachusetts, where we're actually much better resourced than other places. And there are a lot of services in the community. And I think it's hard to navigate these challenging times. But I think the most important thing to remember is that sense of connectedness. It's not just important for the mental health of kids, but also for the mental health of adults.
Exactly. Anything you wanted to add, Dr. Caracansi?
Yeah, I would add to think about getting help early on, getting help when you first have an inkling, and and encouraging parents to take care of their own health, their own physical and mental health, the principles that you're trying to um, instill in your kids. It's important for yourselves to make sure that you have someone to talk to as well, that you have supports and understanding that as a parent, you need to take care of yourself so that you can also take care of others. As Dr. King mentioned, that in Massachusetts, we do have access to resources and care. I think that one of the things that when you are in the emergency room and you are the different levels of care are being discussed. We are fortunate that we have those levels of care available. Like Dr. Kim said, that's not the same everywhere else. So there are options that can be discussed, but that can be overwhelming. So talking it through with the clinicians who are the experts in the emergency department and listening to their recommendations is important. Massachusetts, all the inpatient facilities are regulated by the same state regulatory body, the Department of Mental Health. They all have the same oversight. So just thinking about that, and long stays in the emergency department are generally, not helpful. EDs are not made for prolonged stays. So, we do have the availability of other hospitals that may be able to provide care across our communities.
Wonderful. Well, as we wrap this up, I think, for people watching this webinar who may have joined late, I think, Dr. Qayyum, you really, at the big top of this, you talked about all of the resources and that care ladder and that sense of, let's just kind of pull those apart in terms of what are the things upstream that parents can start thinking about or calling or making appointments until before it gets this acute. And we want to stay out. I guess the goal is to stay out of the emergency room. So for people joining the webinar late or people taking notes and just want to be reinforced, let's talk about those resources that are available to parents.
So just to reiterate,
Yes.
the primary care physician or your pediatrician or your family doctor, whoever that may be a wonderful resource. I think there are also pediatric practices that actually have behavioral health as part of it. They just need a referral from their own pediatrician. So you could actually access mental health care from your pediatrician's office. They might have some resources available to them. School-based service. There are guidance counselors. There can be some groups for socialization for kids. That's sort of a regular check-in for someone. I think eventually, ideally, mental health treatment should be, more robustly delivered from school because that's where the kids are. And I think that would be an area that will get strengthened hopefully in the future as well. But that is a really great resource for schools that actually have it. And really trying to find out, can you get connected with your community resources? And for that, the Mass Health Helpline, which is, masshelpline.com or, 833-773-2445 is a great place to start because, you can call without, insurance preferences, or if you don't have insurance, you can get an idea of what are the resources available in the community. There are now crisis centers and urgent care available in the communities, community-based clinics, where parents can actually access, therapy and medication support if they need. And then again, if there is a crisis, check the Mass Health Helpline. If it's a suicidal emergency, then please 988, and then have them direct you to see, is this something that warrants an emergency room visit or not? But always safety first. We know the emergency room is not an ideal place, but if your child's life is at risk, then keep them safe and bring them to the emergency room.
Thank you, Dr. Qayyum. Any last thoughts, Dr. Caracansi?
Thank you for having us. Thank you for hosting this webinar. The last resource I'll mention, which Dr. Qayyum mentioned, the Mass Helpline, there's a link online. It's fairly easy to Google. I tried it myself and I found it without too much trouble. It is mass.gov. There's a fact sheet for the behavioral health roadmap.
Behavioral health roadmap.
Behavioral health roadmap.
Wonderful. Well, this is a live webinar for those who have joined us, but this will be recorded and then put on our YouTube page as a recorded webinar. And we encourage you to share with friends and family this link to help others and to spread the word and to remind everyone that we are not alone and you are not alone as parents dealing with this really scary situation, and to know that there are many, many resources out there. I just want to thank Dr. Caracansi and Dr. Qayyum for joining us with this Boston Children's Hospital webinar on mental health and this mental health crisis that's around the globe. And we hope we have offered some guidance on alternatives to the emergency room to give your child help. So thank you for joining. And again, this will be on our YouTube page for you to share with friends and family. Thanks again. And thank you guys, doctors, for joining.
Having
Bye,
us.
thank you.